Hello, I'm Sydney. I'll be your advocate through this entire process. I'm a nurse, so if you have any questions during this briefing, I will definitely answer them for you. Alright, so the surgery you're going to have today is a Mohs surgery. It's focused on removing cancerous cells from your cheek and returning your body back to homeostasis, because cancer is really disruptive, so we're just going to return your body back to normal. The type of skin cancer you have is called basal cell carcinoma. I can explain it to you simply. The basal part of your epidermis, which is the top layer of your skin, is the regenerative cells. So basically, these are the cells that are living, the only living layer of the epidermis. They just go up into the rest of the epidermis. They're living. And so carcino means cancer. That's the part of carcinoma. And oma means tumor. So all of it together is basal cell carcinoma. It just means there's a tumor in your basal cell membrane area, and we're just going to remove it today with the surgery. Let's see. Actually, this type of skin cancer usually stays localized, but without treatment it can spread. But it's a good thing you're here today with us because we're going to remove it for you. Let's see. Your skin cancer diagnosis can be identified by looking for patches of darker skin that may seem rough or cracked, just like the spot you have on your face. This type of cancer also mainly shows up on the types of your body that seem more light, i.e. why you've developed it on your cheek after so many years of bad sunburns like in your childhood and just regular exposure to UV rays, which are rays from the sun. Today we have a surgeon working for you. He has a fellowship and he specializes in Mohs surgery. This means you have a very well-versed, fellowship-trained surgeon working on you today, so you're in good hands. He will do his best to make sure that you have minimal scarring, and he will also work hard to ensure your cancer does not return. This type of cancer can return. Once you have it to begin with, it returns more frequently. It's possible, but today we're just going to get rid of what you have right now and focus on that other stuff later. To begin with, your surgery, an anesthesiologist will come and administer a local anesthetic through a needle to your cheek, meaning that you will be awake during the surgery, but don't worry, there will be no uncomfortableness. You won't feel a thing. Then, with the help of his technicians, the surgeon will use a scalpel to make a laceration around your tumor. He will take some of your healthy cells just to be sure that he has taken all of the cancerous cells. So he'll take a little outline around the cancerous cells just to make sure he's gotten all of them. To check this, after removing the main portion of your tumor, the surgeon's technicians will prepare the tumor to be viewed through a microscope. So the surgeon will go into his office while you're still in, the room. He will go into his office and observe the tumor under a microscope, and he will look in the healthy cell area to see if any cancerous cells are in that area. If they are, then he will come back and basically make another incision in that area that he saw cancerous cells in the healthy cells. He's trying to make sure that he gets all of the cancerous cells out of your cheek. He wants to make sure that it doesn't come back. He wants to just get that good outline of the healthy cells around the cancerous cells. This process, going back and forth between the microscope, him checking everything to make sure he got it all, it will take quite a while. So the typical time for this procedure is 4 hours, but again, like I said, it depends on how many times your surgeon, how fast he is with the microscope and checking and stuff. You want it to take a while just to make sure that he knows he got all of your cancer cells out of your skin. After this procedure, you will most likely experience cicatrix or scarring afterwards, but it's typical of these types of procedures. Usually we are able to allow your scar to heal on its own, but sometimes there is call for reconstructive surgery. The surgeon will inform you of your available options for this reconstructive surgery, but usually we don't go down that path. It's very rare. If you do have to go down that path, you will need to see a specialized dermatologist. But scarring, your normal scar will just fade over time, like normal scars do. But yeah, right now it's just going to be a little irritated, but it will eventually die down. After your discharge tonight, you will need to keep up with your care of your new sutures. So I will go over all of that information with you when you get out of surgery. I will need to teach you how to clean your own bandages. I would recommend keeping your wound moist and covered until you come back to us to get your stitches out, just so we can make sure your scar, is well healed and good looking when it eventually does heal. So for the follow-up, I'll need you to come back in 2 weeks to get your stitches out. This surgery is one of the easiest skin cancer surgeries to recover from, so I believe you won't have a hard time at all. Thank you very much.